Welcome to ADAPT NCLEX. If you're in nursing school and you're having problem with the Pitocin dose calculation, there is several variations. It depends on the question they're going to ask you. I'm going to show you how to titrate it and make a decision. These are tricky questions, but with this video, you'll be able to manage it flawlessly. Trust me, it will be easy for you because there's a concept associated with it. Let me show you quickly. What is the question? What is the next expected infusion rate at this time? That is what the question they're asking you. Read the question and figure out what they're asking. You can see a lot of information, but don't worry, I got you. Look at it. A nurse is caring for a laboring client with Pitocin order. This is the order that was given. You start the infusion, there's always going to be an order. 2 milliunits every minute. Give it to the patient, but increase it by 2 milliunits every 30 minutes, right? Until what? There's a goal. Until contraction are achieved, adequate contraction achieved. You should not exceed the dose. You cannot keep on increasing it until you're above 20 milliunits. When you get to a certain point, we know that you're going to achieve contraction. It depends. So don't exceed 20 milliunits to achieve contraction. The nurse, though, starts the infusion. They always will give you the time you started, 8 o'clock. By 10 o'clock, contraction remain inadequate. Patient is not getting good contraction based on the criteria given you. What infusion rate do you need at this time? What is the next expected infusion rate at this time? Look at what I'm going to do. It's easy, it's confusing, but it's not. It shouldn't. The question followed the instruction. They said titrate it. So titration, I put my titration here. And they said I should start what? 2 milliunits, right? Every minute. And what is the time I start? 8 o'clock. And the question say every 30 minutes, you should increase it by what? 2. So at 8:30, I'm going to increase this by 2. That will be 4 milliunits. At 9 o'clock, I'm going to increase it by 2 again, 6 milliunits per minute. At 10 o'clock, no, 9:30, I'm going to be having what? 8 milliunits. At 10 o'clock, this should go up to what? 10 milliunits. This is the infusion that you should be having at this stage. What is the question asking you? What is the next expected infusion at this age time? That's all. Just increment it as you go. Sometimes you get to the point you have to make a decision. So at 10 o'clock, the Pitocin infusion should be what? 10 milliunits per minute. Even though we have not achieved contraction, well, we still have time. They said we can go up to 20, but we should not go past 20. When you see these questions, don't run away, or the answers are over there. 10 milliunits. That's all. Number 3, your answer. You got it? So let me give you another variation. The same thing. This one, you have to make a decision. But it's the same thing. What is the next best action? A client in labor is receiving Pitocin. There's always going to be a protocol. What is the protocol? I want you to start at 2 milliunits, right? Then increase it by 2 milliunits every 30 minutes. Until what? Now they're giving you what is your endpoint. The contraction should be what? 2 to 3 minutes. If you achieved it, that's the key. You should stop. You should, the lasting of your contraction, the duration of your contraction should be what? 60 to 90 seconds. And you should contract every 2 to 3 minutes. If you get that contraction based on your titration, what should you do? Stop. Don't go any further. They will tell you don't exceed 20. But they want you to keep on titrating until you achieve what? 2 to 3 minutes in between contraction, and contraction lasting 60 to 90 seconds. The next start the infusion what? At 7 o'clock. Then at 8:30, the client is what? Is receiving 6 milliunits. This is a little bit a bunch of information, but it's mathematics. Just pull back. I got you. At 8:30, when you check the time, the patient is receiving 6 milliunits. The current urine contraction is occurring what? This is what she's doing. 2 minutes, and then it lasting 75 seconds, and is moderate. What should you do? Look at it. You started at 7, and the unit was 2 milliunits. At 7:30, you were 4 milliunits. At 8 o'clock, right? You're going up, you keep on going up. 6 milliunits. At 8:30, you should go to what? 8 milliunits. But that's the question they ask you. Should you go to 8 milliunits? You say at 8:30, what is the patient going? He's receiving the 6 milliunits because now it's time for you to increase it. Should you stop it or continue? And the contraction that you find was patient is contracting every 2 minutes, right? And they lasting 75 seconds. Test taking strategy, that is exactly what they've given you. You have achieved your goal. They told you 2 to 3 minutes is fine. I'm within 2 minutes. 60 to 70, 60 to 90 seconds, I'm what? 75 seconds. That means I'm within the range. Why should I increase it? At this point, I've achieved my goal. I should keep the infusion at 6 milliunits because if I go up to 8, the patient probably will contract more. It will have tachysystole. Therefore, don't increase the dose to 8. Maintain the current rate. If you decrease it, you will lose your achieved goal. You should not discontinue it because you have achieved your goal. Therefore, maintain therapy. This is the way you do titration and what? Decision making when it comes to Pitocin. Thank you for watching. I have a video series. If you want more, subscribe to ADAPT NCLEX. There's a playlist on Pitocin and IV fluid calculation and drip. Take care of yourself and bye. And good luck in your nursing school.